you as a healthcare worker, as a counselor, and somebody who used to work mental health crisis response for years. And I know that there's a way that plays out better.
The man shot and killed by a Killeen police officer after a mental health related 911 call over the weekend has now been identified. The family's attorney says 52-year-old Patrick Warren Sr. was unarmed when he was shot by that cop on Sunday.
In an exclusive interview, attorney Lee Merritt tells 25 News that the family is devastated. They're now demanding the immediate firing and arrest of the officer responsible for Warren's death. Arlene McNeil has more tonight, and I do want to warn you that the following video is graphic and may be disturbing to some viewers.
This is Merritt's second case involving a Central Texas Police Department. First, Michael Dean in Temple, and now Patrick Warren Sr. in Killeen. What initially started off as a call for help, Merritt says turned into a death sentence for Patrick Warren.
They noticed their loved one deteriorating, undergoing some sort of psychosis, it appeared. They spoke with medical professionals. They want to get him some help. In an effort to try and calm Warren Sr. on Sunday, Merritt says someone in the Warren home called the police, which did not go as planned. An aggressive officer who's speaking in an abrasive tone, who clearly had an attitude. He sort of stormed out of the home. The family described it as he slammed the door behind him. Based on the video, Merritt says the officer had an aggressive stance after engaging with Warren Sr. Then he leaves and takes a tactical position as if he's preparing to engage this man in his home. When looking at the video, you can see Warren Sr.'s arms in the air, taking steps forward. The officer asking to see his hands and saying, "Get down on the ground," as the family says, "Don't shoot him." You can hear Warren Sr. being tased. Not long after.
Hey, Dad, sit down. Sit down. Sit down. Sit down. Please.
The first of at least 3 gunshots are fired, a family member screaming.
No! No, I told you don't use a gun!
I've been on calls that looked exactly like that, hundreds of them. And I know that there's a way that plays out better. I know there is. I've seen it. I've been involved in it. After spending years as a mental health crisis advocate responding to psychiatric calls alongside law enforcement, Dr. Jeremy Berry says Warren's response is not out of the ordinary. Even if you wanted to make a statement that he was behaving aggressively or erratically, erratic behaviors are not uncommon territory for that particular situation. Dr. Berry says the presence of law enforcement can oftentimes further agitate someone who is having a mental episode, which is why proper training is paramount. Again, I'm not in a position to really say what was going through the officer's head, but I can tell you from a healthcare professional, there are other methods to address that situation that might not require someone to lose their life. Dr. Berry says this incident sheds a light on a nationwide issue of a lack of mental health services across the board. Officers are required to undergo a 40-hour crisis training, but it's up to each individual department to require more extensive teaching specifically dedicated to mental health calls. Reporting in Killeen, Leah McNeil, 25 News.
Leah, thank you. Now, we did reach out to the Texas Rangers who are leading this investigation for comment. A spokesperson said at this time the investigation remains ongoing and no further information can be released.